video, I want to help you answer the question, is stress actually causing your hair loss? I want to do this by answering the following common questions that I get about stress and hair loss. The first question is, does stress actually cause hair loss? Well, the following studies show that there is at least a correlation between stress and hair loss. This first study is a study involving 424 patients. Half of them were male and half of them female. And it looked at the incidence of hair loss in patients with different levels of stress. It found that in men, there was an incidence of hair loss of 7.5% in those with low stress, 9.8% in those with moderate stress, and 32% in those with high stress. You can see that the men who had more stress experienced more hair loss. The females in the study showed a similar trend. They had overall less hair loss, but still showed that increased hair loss with increased stress. Another interesting study I found was a study of 300 medical students, of which 257 out of the 300, so a large portion of them, experienced hair loss over a 3-month period whilst they were undergoing medical school exams. And the majority of the hair loss victims unfortunately experienced moderate to severe hair loss. Now, as we like to say in the scientific field, correlation does not necessarily mean causation, but we can definitely say that these studies suggest that there is a correlation between stress and hair loss. Let's jump into the second question on my list. What type of hair loss does stress cause? This study's overall conclusion was that stress causes telogen effluvium, or TE for short. What is telogen effluvium? Well, TE occurs when an external trigger causes a hair follicle to prematurely switch from the anagen phase, which is the growth phase, the phase that we like to see our hairs in, the phase that most of our hairs are in at a given point in time. It's the phase to which we see the hairs grow nice and long and healthy. It causes a premature switch from anagen to telogen, where at the end of telogen, a shed occurs. With telogen effluvium, more of the hairs on the head are in the telogen phase, and therefore more of them are going to shed once telogen ends. And that's what we see as a telogen effluvium shed. Now, the two main characteristics of a telogen effluvium shed is that it occurs and affects hairs all over the head, including the sides and back, the donor area that we traditionally call in men. And it also occurs over a short period of time, usually about 3 to 6 months. Unlike androgenetic alopecia, where in men it presents as recession of the hairline, thinning of the hair in the crown, or a diffuse thinning of the hair on top of the head, preserving the hair in the back and sides in that donor area. And in women, androgenetic alopecia presents usually as a widening of the parting of the hair. On that topic of androgenetic alopecia, another conclusion from this study was that there is actually no evidence that stress makes androgenetic alopecia worse or affects it at all, really. What do other papers say about stress worsening androgenetic alopecia? Well, this was a study of 37 male patients in which a detailed questionnaire was used to work out if those with more stressful life events experienced earlier onset male pattern baldness. And the conclusion was that there was no link between more stressful life events and early onset male pattern baldness. So these studies suggest that stress doesn't cause or worsen androgenetic alopecia or male pattern baldness. But why does it cause telogen effluvium? Well, the answer is we don't know, and it's likely a very complex answer involving molecular biology and genetic switches. But one theory is that the mechanism involves cortisol. Cortisol is the hormone released by our adrenal glands when we are stressed. And this study here, yes, it was a mice study, but it did show that removal of the adrenal glands increased the number of hairs in the anagen phase. And when they did the opposite and gave more cortisol, the anagen phase actually was shortened. This does suggest that cortisol could shorten the anagen phase and therefore reduce hair growth. How do you treat stress-related hair loss? Well, the obvious answer is just chill out. I'm joking. Obviously, in some situations, that's not actually possible. So are there any medications that we can use to treat stress-related hair loss? Well, this paper here talks about treating stress-induced telogen effluvium. It suggests that to treat stress-related hair loss, you can just take minoxidil. The study suggests that minoxidil could be used to resist that switch from anagen to telogen in telogen effluvium. However, whilst this seems plausible, it doesn't solve why telogen effluvium occurs in the first place. It doesn't stop you from being stressed. Next question is, does finasteride work for stress-related hair loss? Well, it doesn't make sense for finasteride, being a hormone blocker, to stop this type of loss, as stress-related hair loss happens by a different mechanism than in male pattern baldness. So what should you do with all of this information? Here are my 3 main conclusions from all of these studies. Well, the first conclusion is that stress seems to cause telogen effluvium, which is a premature switch from anagen to telogen. Simply put, to maximize anagen, minimize stress. And I'm sure you've heard it many, many times, but actually getting regular exercise, consistently good sleep, and a balanced diet that is not too high in saturated fats, salt, and has a good amount of fruit and veg is actually going to reduce your stress in the long term, maximizing your chances of having the thickest, healthiest hair possible. The second conclusion is that stress does not appear to cause or worsen androgenetic alopecia. My final conclusion from these studies is that if you're someone who is stressed all the time, for example, from your work, but you can't do anything about it because of various life situations, topical or oral minoxidil may actually be an option for you to counteract the effects of stress-related hair loss. Hope you guys found this useful. Thank you for watching.